our debate was on, is lifestyle management and lifestyle recommendations helpful? What's the evidence for it? Or is it actually harmful, and can it blame the patient? So it was a really great debate. I basically talked about how lifestyle management does have evidence for some parts of it, but really it's important to emphasize positive and proactive lifestyle changes. So when we talk about lifestyle management, we're talking about routine. So routine sleep, routine exercise, eating on a routine schedule, as well as hydrating appropriately. When we look at those lifestyle recommendations, really the best evidence is for exercise and sleep. So there are good studies showing that getting good quality sleep, as well as maintaining a relatively narrow sleep window of 7 to 8 hours a night for adults, is more beneficial for migraine management. And that insomnia, sleep apnea, and other sleep disorders are comorbid with migraine, and that treating them and identifying them is really important. And we do know that treatment of insomnia with cognitive behavioral therapy for insomnia can improve migraine outcome and reduce frequency and severity. For exercise, there's a lot of studies out there that actually show the benefits of exercise. The takeaway points really are, what type of exercise, right? Everyone says, let's go exercise, but nobody's really telling you what is the studied exercise modalities for migraine. So aerobic exercise has been found to be better than anaerobic exercise. So cycling, elliptical, running. The duration, it kind of varies in studies, but the mean duration seems to be about 40 minutes on average, 3 times a week. And there was a recent study that showed that high intensity interval training, or HIIT, as we might know it as, is more beneficial than moderate continuous exercise. So it's better to do short bursts of high intensity exercise than just to go at a moderate pace and do it for a longer period of time. I think there's a lot of question over, well, doesn't exercise make headache worse? Like, what happens if I can't exercise because I have such a bad migraine? Totally valid, totally get it. And that's something that we talk about all the time. Well, there is evidence for yoga. So yoga can be helpful as an add-on therapy for migraine. For tension type headache, it also has been shown to be beneficial just as a sole agent. So exercise, really, yes, we would like aerobic. If you can't, it's okay. Starting with some gentle yoga and then building up. Really, the migraine brain likes things to be eased into. Jumping into an exercise program is not really going to be good for anyone with migraine. So just starting small is really important. So those were the main beneficial lifestyle management recommendations. There is some benefit for diet. The studies aren't great. It more looks at consistency. So not skipping meals, trying to eat breakfast. There's one study that showed that late night snacking actually helps to reduce migraine, because I guess you're eating at more frequent intervals. In kids specifically, really there's an association of skipping meals, skipping breakfast that has been shown to worsen migraine. But on the flip side, there's been no studies that have shown that if you eat consistent meals and you eat breakfast, does it actually improve migraine? So really the evidence there shows, yes, doing something might not be good, but if we fix that and actually do it correctly, is that going to improve migraine? So I definitely think there's room for future studies there in terms of nutrition. The recommendations really should be more proactive. So eating high quality foods that have a good combination of proteins, high quality fats, and really just trying to stay away from overprocessed foods. So triggers, just trying to eliminate whole food groups, there's really not great evidence for it, nor is there great evidence for one specific diet. So proactively incorporating good quality food and eating consistently seems to be the best recommendation. For hydration, that's the one that really has the littlest evidence. So how many times have you seen a meme or gone on like Instagram? It's like, drink more water, just drink more water and everything's going to be great, right? It's going to heal the migraine. Honestly, if I hear that one more time, I think I might just scream, as will a lot of my patients. But there's actually only been one study done on hydration. And that was done in adults. And they were basically told to add another 1.5 liters of water a day to their baseline. Showed some improvement in migraine disability, but really had no impact on the frequency of migraine attacks. There's been no studies on hydration in kids, so we sort of just extrapolate from there. Yes, hydration is good. Drink more water. Great. It's great for overall health. I mean, we know that dehydration is linked with more fatigue, trouble thinking and concentrating. So hydration isn't going to hurt you, but will it be helpful for migraine? I think the jury really is still out on that one. So it's one that now in my practice, I don't really push that much. It's like, great, drink water, but I don't necessarily think it's going to make or break anything.